Hey everyone, back at you with part three. So let's go back to, we left off at chain of infection and we were talking about a little bit about the host. And I was just noting that I think some important things that we can all do, especially myself, can do a little better of. That's eating healthy, drinking right, staying away from too many beverages, if you know what I mean, and getting some workout in, getting some cardio, lifting some weights. I think that goes a long way in staying healthy, not getting sick. Could definitely possibly help, if definitely not worsen COVID. Eh, Although let's be honest, I'm not a doctor, but I think these are all things that we can generally agree upon. And yeah, I think it would help reduce transmissions, and the likelihood of you getting it would go down at least somewhat. Let's move on to the next slide, modes of transmission. So we have direct contact, which is the touching or contact with blood. Then next you have indirect contact, which is the touching of contaminated surfaces. You have airborne infections such as coughing, sneezing. You have things like splatters from the air-water syringe and aerosol cans. And then you have a parenteral transmission, which would be like needle sharps, stuff that like can pinpoint inside. All right, we have disease transmission. We have patient to dental team. So that would be like, let's say some easy ones would be COVID if a patient brought in COVID, or maybe they have hepatitis C, hepatitis B, even maybe the measles. They can transmit that to the dental team. So that's why we wanna stay safe, stay patient, follow our guidelines, and then practice safety first. Don't get complacent. Be aware. So next we have the dental team to the patient. So, if we're sick, we have the flu, that can be transmitted from the dental team to the patient as well. So, if you're sick, you're gonna want to stay home. You want to take every precautions that you can in order to keep everybody safe, especially your patients and everybody in general. The next one you could have is patient to patient. So let's say, again, COVID's an easy one to use. You've got a bunch of people in the waiting room. You're not practicing your guidelines. They could easily get a flu, get some of these things that we don't want them to get the COVID. So we just gotta be mindful of that stuff. All right, let's move on to our questions and answers and scenarios. So this will be a little bit overview of some things that we've gone into, and kind of highlight some areas where things could go wrong in the dental setting, dental office setting, and some basic general questions. All right, so after seating the patient, what personal protective equipment, PPE? So I just want to clarify that in video one, I did make an edit to it down below that I called it proper protective equipment. Excuse me, that needs to be edited to personal protective equipment. So in case you did not see that notification, down in it's in the subtitles, and also the description down below of that first video, part one. I believe it was around 1 minute and 50 seconds that I made that error. So I just want to be clear that it's really tough to edit, but I did want to make that notation. So let's go over the question again. So after seating the patient, what personal protective equipment should be put on last? A mask, eyewear, gloves, or gown? So what wants to be put on last is gloves. And so to further on to caveat off that, a good order to have, and this is based off of the sequence for putting on personal protective equipment, which is CDC guidelines. It goes, start with the gown, then the mask or respirator mask, then your eyewear, your face shield, your goggles, and then last you put on your gloves. So that is the correct order, following the CDC guidelines. Next we have question 2. What type of gloves should be worn for instrument processing? Heavy utility gloves, nitrile exam gloves, which are the patient gloves, powder-free gloves, again patient, and vinyl exam glove, those are also patient. So the correct answer here would be the heavy utility gloves because they're made of that thicker material, and they're the ones that are going to keep you more safe, and those are the ones that you're going to want to use. So all the other choices are patient care gloves, and these are the utility gloves. And the correct answer was A. So question number 3, a dental assistant has punctured herself with a contaminated needle. Which of these should occur immediately? We have A, applying the antiseptic to the area affected. And by the way, these were taken from our tests on bloodborne pathogens, so kind of give us that review as well of the scenarios and situations. So was it A, applying antiseptic to the area affected, B, make the area bleed, C, washing the area with soap, or D, report the incident to the supervisor? So the correct response would be C, washing the area with soap. All right, moving on to the next one. So a quick scenario, and this was also somewhat adapted from our assignment that we had for the OSHA and the correction scenarios and rationale. So we have a patient, 65-year-old male or female, comes in for a routine cleaning, complains he has not been feeling well, and complains of fatigue and shortness of breath. What should you do? So what I would do in this situation is that we want to check him. Let's do our pre-check. He says he's not feeling well. Maybe let's do a little temperature check like we were talking about at the door. Ask him those simple questions, especially with the COVID now. He's an older gentleman, so we'd rather not put him at risk. And I would honestly, it would be advisable to send him home. He should come back at a later date. We don't need to do this now. He needs to get home, get some rest, and focus on himself, and we can always reschedule the appointment. All right, guys, we have covered a lot. We have went over OSHA regulations, recommendations, bloodborne pathogen standard, the waste management. We covered some infection control guidelines. We've discussed and reviewed some questions and some scenarios and situations. So I hope you guys have enjoyed my presentation. Thank you very much. Have a good one.